Pain is special, though. We all know this. Pain is the only sense that doesn't habituate. So if you think about other senses, the last bite of cake that was so delicious, the first time you had it and it looked beautiful, the last bite is not that great. It's good, but it's not as good. Or, after a while you get used to how the cheese smells and you enjoy it. Or perhaps you live near an airport and the airplane that annoys the hell out of you, you just start to get used to the sound and you don't notice it anymore. All of the other senses work like that, except for pain. And it sort of makes sense, because why would you want to get used to pain if it means that there's going to be some sort of bodily injury that's occurring? So that's one of the reasons why pain is called a primary reinforcer, in that inherently, without any type of conditioning or learning, people and animals will avoid whatever just caused the pain. That means that it's a very potent learning signal. So even just baseline, even without augmenting the suffering associated with pain, for instance with chronic pain, you already have the ingredients for strong memory. Acute pain and chronic pain are different for some important reasons. A lot of times I think that people think that chronic pain is simply acute pain that lasts for a really, really, really long time, but it operates on different rules. So not only does it, have a different temporal scale, 3 to 6 months after the injury, if you know what the injury was. It doesn't necessarily need to be evoked. It could be spontaneous in nature. The more quirky thing about it is that it can be triggered by emotional information, not just sort of nociceptive input. And this means that it's affecting a different part of the brain, not purely sensory encoding regions. It's also affecting the reptilian emotional brain. And this can have really large scale effects on the brain. I'll show you in just a moment. What I'm trying to get at here is that chronic pain is emotional. Normal pain is emotional to begin with, but chronic pain becomes inherently emotional. So it doesn't follow the same rules, yes. So how do we know that it's emotional? One thing is that whenever we look at brain regions that encode just normal pain in healthy people, you see like this it's called the pain matrix, which really isn't a pain matrix, but there's a sort of a reliable group of regions that activate in fMRI studies whenever you have pain. And so, obviously, the people made the assumption that this is just how all pain occurs. However, you'll see that with the chronic pain conditions, you don't have the same types of activation. Some of the same activation, but you'll also notice that, for instance, the MPFC, medial prefrontal cortex, you have an increase in information. The PFC specializes in emotional learning. So this was the first indication that we had. This is some of the best evidence I know of that chronic pain is emotional. So this is a study from Vanya Apkarian's lab. He did a 5-year longitudinal study, a 5-year project, where he followed people for a year. He'd find them within the first 2 to 3 months of having back pain, low back pain. And he wanted to see if he could predict who would have pain a year later based purely on their brain activity or questionnaires or their brain structure. So over several time points, 4 time points over the year, he scanned these brains. And after, it was a huge study, over 150 people were in it. Afterward, conveniently, there were about half of them that got better, half of them didn't. If you use better being a 30% decrease in pain or more, right there. So the people who recovered, you see these typical brain regions. These are the typical pain matrix type brain regions that essentially process sensory information right here. And you can see that in both groups, it's very similar. It's the first few months. It's still essentially a sensory experience. All of the patients show this. However, in the individuals who recover, you see sort of a diminishment of that over time, essentially because they can't rate pain anymore. They don't have it. So you won't find just spontaneous pain activity.